Welcome back, guys. Today we had the chance to ask a few second-year Binghamton University physical therapy students one thing they learned from their first clinical rotation over the summer, and here's what they had to say.
Hi, my name is Janelle. I'm a second year student physical therapist, and this past clinical, I was in a rural outpatient clinic, and had two main takeaways during the summer. One being that you know more than you think you do, so don't doubt that. Just be confident and do what you've learned, what you've studied so hard for. And the second thing that I took away from was learning about vestibular issues. That was my first really big introduction, and we had such a large volume of patients who came in with vestibular-like issues. They weren't always true vestibular issues, and that actually influenced me to do my in-service on the different types of dizziness and how to differentiate that with differential diagnoses that aren't truly vestibular. So that was pretty cool, something that I took away.
Thank you, Janelle.
Hi, my name is Aisha. I'm a second year DPT student. For my first clinical rotation, I was at like a high patient volume outpatient clinic, and I would say two main takeaways that I learned are one, the importance of like collaboration. So whether that be working with the PTAs, PTs, OTs, as well as the aides, when you guys are kind of like on one page or one accord, things tend to go more smoothly. And then another main takeaway that I had was during our first year, we briefly touched on like TMJ, but while on my rotation, I dived a little bit more into TMJ as well as pelvic floor, specifically focusing on like the treatments, what symptoms to look out for, what interventions that can be like prescribed to a patient and things like that.
That's good. Thank you, Aisha.
You're
Hi, my name is Gabriel. I'm a second year DPT student. I would say it's very difficult to pinpoint one particular piece of information I've gathered this past summer in my clinical rotation at an outpatient clinic. I would say a big one that I didn't think I would be putting so much emphasis towards was body mechanics. And because I'm young, I'm 25, I figured that's something that you would experience kind of towards the end of your career. And let me tell you, after a 7-hour day doing manual therapy, and if you don't really follow those strict body mechanics, you really start to feel that. So that was big pointers I got from my CI on how to properly do manual therapy with patients and preserve your body. And if I had to give a second point, I would say the McKenzie ideology of treating chronic low back pain and cervical pain as well. That knowledge really helped, and what constitutes like when would you put somebody in an extension category or a flexion category, and how to treat patients using that ideology. So some gems from the summer.
Perfect. Thank you.
Hi, my name's Emma. I'm a second year physical therapy student here at Binghamton. Something I learned in my first clinical is that physical therapy is not a one size all. For example, you may have multiple patients with the same diagnosis. However, you might treat them completely differently based on their presentation and what they are telling you. So it's really important to be creative with your interventions and just ultimately listen to your patients and their concerns.
All right, my name is Talal Corey. I'm a second year DPT student, and for my first rotation, one of the things I learned was a lot about insurance companies and their different policies and how each one matters when getting approved for different patients for more visits. I also learned a lot about, in terms of physical therapy side, just learning about having different variations for exercises for patients to really understand, and maybe having multiple cueing ideas for patients to really understand for the movement that you're trying to get and the exercise that you're trying to have them do. So I just learned a lot about that.
Thank you so much. Appreciate it.
All right, so my name is Eric. I'm a second year PT student here at Binghamton, and I learned a lot of things this summer, but two big things that really kind of stood out to me were the first one was the importance of the subjective and learning how to really hone in on the core reason why they're coming into physical therapy and kind of ruling out any kind of red flags during your initial evaluation. And then the other thing that I learned a lot about was learning how to scale your exercises, coming up with variations like kind of on the spot when someone comes in and they're not feeling just as great as they were from the previous visit, and just learning how to, you know, adjust those exercises to set the trajectory going forward for good prognosis.
Solid. Thank you,
Thanks,
Eric.
man.
Hi, my name is Dana Kurthy, and something that I learned over clinical is about BPPV and BPPV testing. So one of the things to look for in patients that could possibly have it is if they have sudden like room spinning sensation, it should come on like more suddenly. And so what happens with BPPV is the crystals in your inner ear get dislodged into your semicircular canals, and that can happen from things like vitamin D deficiency or if they were just taking antibiotics, something like that. So I learned how to kind of diagnose that, and then through testing, doing the Dix-Hallpike maneuver as well.
Hi, I'm student physical therapist Justin Roncano, and a big thing I learned this summer for my first rotation was to treat the person and not the impairment. So basically, we come in with all these, the patient is more than a chart. So I know we come in with all these tests and mindset of how we're going to treat the patient, but really the patient has their own goals and frustrations that they're dealing with in their everyday life. And we need to really put an emphasis on the therapist part because these people are coming to you with their problems, their frustrations, and what it is exactly they want to get back into in their life. So I think the most important thing is to just hear our patient out, work on the active listening, the empathy. Don't just treat them as if they're just another case study on your paper that given an exam. Really treat them as a person and help them to their goals, basically.